Hello, this is Jacob Avila of 5 Minute Sono, and today we're going to learn to use ultrasound to perform a median nerve block. Your probe of choice for this procedure is going to be the linear probe. Basically, any time you're sticking the needle in the human body, you probably want to be using that linear probe. The median nerve is going to run just in the midline on the anterior part of the forearm, just about right here. And you can do it wherever you want, but personally, I like doing it about mid-forearm. I found that the median nerve is a lot easier to identify there. What is this nerve block going to get you? It's going to get you anesthetic in this region right here. The major one would be the radial side of the hand, including the thenar eminence. It'll get these two fingers on the palmar side, and it'll get just basically the proximal palmar side of the thumb. It's not going to get out here because there's a bunch of mixed innervation there. There are two ways that you can do this block. You can do it in long axis or you can do it in short axis. Both work. So here's an example of doing it in the long axis. So here's my superficialis muscle up here, my profundus muscle right here, and the median nerve usually sits right in between those two in the mid-forearm. Now over here you have the radial artery, and Matt Dawson's making sure to not pierce my radial artery, so he's going to adjust his needle and make sure to go beneath it. He's a little off axis here, but soon he's going to adjust his probe to get a better visualization of that needle in long axis. And what he does here, which makes great sense, is he's going to go a little bit past the nerve that you see here and make sure to infiltrate the area around it, because what you want to do is you want to surround the nerve. And after you get below it, you can always go above it and administer a little more like Matt's doing here. I'll often actually do this in the short axis. You tend to have to go through a little less tissue, and you don't have that issue about making sure to avoid the radial or ulnar arteries depending on which way you go in. Now, the only caveat with this is that visualizing the needle is a little trickier. So when you get a little bit better, it might be a better idea to do it off axis. And while you're learning it, do it on axis. So here's my needle. I kind of fast forward it. You can see it right around here. Now I'm going to infiltrate the area in between the superficialis here and the profundus here. And here's my median nerve. Now you can see that anesthetic kind of tracking between the nerve and the muscle. Then pop through right below it and infiltrate below too. That way you get a nice surrounding of that nerve. So to recap, make sure you know the distribution of the median nerve. I'm all about doing procedures, but you shouldn't do them if they're not indicated. If someone's got a laceration on the tip of their thumb, this one's not going to work. If someone has a laceration on the dorsal side of their hand, also not going to work. But if the patient has something going on in their thenar eminence, this is the perfect block for it. Remember, there are two ways you can do this. You can do this in the long axis and in the short axis. Depending on your comfort level, you can do one or the other. I don't think there's necessarily any benefit over one or the other. It's just which one you feel more comfortable with. That's it for this week's 5 Minute Sono. If you have any questions or comments, feel free to email me or send me a tweet. And don't forget to subscribe. Go to blog.5minutesono.com/subscribe, put your name and your email address, and never miss another video. And if looking at websites isn't your thing, you can always subscribe. Go to iTunes or whatever other podcasting site you use, type in 5 Minute Sono, leave me a rating or a review, and subscribe.